Kelly, we are really in a new bar in terms of the case numbers we are seeing in COVID right now. Every day since November 4th, we've seen more than 100,000 new cases every day in this country. 103,000. That was the day we crossed that 100,000 milestone, the day after the election. Now up to yesterday, seeing more than 130,000 new cases. That is a new daily single-day record. And the rate of growth is still accelerating. According to Evercore ISI, that 7-day moving average, now it's at 119,000 cases per day. That's up 40% from a week ago. Look at hospitalizations as well. You were just talking about Scott Gottlieb's tweet about that. Yesterday, 2.8 thousand more people were hospitalized. That is a record number in one day, according to Evercore. Total 62,000 people in the hospital right now. We're looking at levels when you look at deaths that we haven't seen since mid-August. More than 1,300 yesterday in the United States. So, Kelly, it's a bad situation. Let's look at the hotspots, the areas of the country where we're seeing case growth the fastest. You're looking across Iowa, Kansas, North Dakota, Wisconsin, and Illinois. But really, we're seeing this case growth everywhere. This is happening all around the country. And that's why you're seeing health experts particularly worried, because back in the spring or over the summer, this was really targeted regionally. And so you could shift resources if you needed to, particularly staffing. Remember when folks from out west came to New York to help in the hospitals. But with everybody pressed, they're so worried that there just won't be enough staff to take care of all these patients. Kelly?
Yeah, it makes me think we need to get the heads of some of those hospital systems on, because, I recall when Houston was facing its own spike, they were doing a lot to say, yes, okay, you might see that we're reaching 100% of ICU capacity, but we have tents, we have extra ways of creating space. Do you know if that's the case for a lot of these other places, and if that's kind of a safety valve here?
You can create beds, you can create space, you can get more stuff, but what everybody says, you can't get more doctors, nurses, the staff you need. You can't create more people with this expertise, and that's the main fear.
Yeah, that's a great point. All right, Meg, thank you. Meg Terrell with our latest this hour.
Shepard Smith here. Thanks for watching CNBC on YouTube.